Hello Spiders and happy Monday. This week is Mental Illness Awareness Week. So today we're going to talk a little bit about how to reduce the stigma around mental health and how to utilize resources. So just a few things that everyone can do to try to reduce the stigma. First would be normalizing talking about mental health and using services. So what this means is when we have conversations in our day-to-day life, it's okay to talk about having a tough time, having some certain symptoms, and even talking about if you go to therapy. Obviously, we want to be careful about who we're talking to this about, but especially for those that you're closest with. Another thing that we can do is be very careful about the language that we're using around mental health and mental illnesses. So for example, trying not to use words like crazy, insane, psycho to describe people when they're acting a little bit differently than normal. And then the last thing that I think we can do to help reduce this stigma is using what we call person-first language. And so that means that when I'm describing somebody or what they're going through, I'm describing them as a person first. So they are a person who is struggling with some sort of mental health issue, depression, anxiety, a person who maybe has autism or has another diagnosis, as opposed to calling them by their diagnosis first. So instead of calling them a depressed person or an autistic person. Again, the language that we use is so important for how people think about mental health. And so the more we can do to use normal language and make it seem more normal to talk about it and considering that person first, the better off we'll be. Last, there are lots of resources available to you, whether it be locally, on campus, within the city or the community that you're in, or nationally. So feel free to check out our website for a ton of resources available to you that you can use to support yourself. And as always, if you need something, reach out for help. I hope these things help, and I hope it opens up some conversations around Mental Illness Awareness Week. So have a great week, and we'll see you next time.